Welcome to Wellbe, AmeriMed MIH Community Paramedicine Education, and thank you for attending this training. Thank you for your time, and most importantly, thank you for your continuing efforts to provide a superior level of both patient care and customer service. We appreciate the challenge in the shift from EMS to community paramedicine procedures. Many of us have come from 911 or EMS services, where in the course of our ALS patient care, we would acquire a 12 lead on many of our patients. ECG strips were interpreted and usually discarded as unremarkable. This is not an acceptable practice in our Wellbe Senior Care community paramedic procedures. Legally, we cannot, as that practice could easily create a delay of our care situation. We must always recognize that as a community paramedics in this environment, we are delivering patient care under the medical direction of primary care physicians. So welcome to the Wellbe Community Paramedic Zoll E-Series 12-lead ECG protocol step-by-step instructions. Step 1 is to consider the nature of the call. Occasionally, the community paramedic will be dispatched specifically to acquire an ECG. More often, an APC will order an ECG based upon your assessment findings. If this occurs, ask the APC which physician will be reviewing the ECG. Occasionally, an APC may ask why. If this occurs, please explain that the orders from our medical direction are that every ECG must be reviewed by a Wellbe physician immediately. In most cases, this will be the on-call physician for the month. The other possibility is that based upon your assessment findings, you feel an ECG is necessary to rule out a possible dangerous condition. If this occurs, inform the APC of your findings and ask if they agree. If so, get the name of the physician that will review. Your next step in the process is to contact the doctor. If the physician is unable to answer a voice call, then leave a voicemail and send a text message. But always confirm with the doctor that they are aware that you will be sending an ECG to their email in a few minutes. An example of such a text message would be, "Good morning, doctor. Your community paramedic David here. Per the APC, I'm going to send you an ECG via email for a 72-year-old female complaining of substernal epigastric muscle spasm." If there is no reply to your text message within a few minutes, make a voice call to follow up and ensure the physician is expecting the ECG. Turn on the monitor. Wait for screen to boot. Make sure 12 and 4 lead connection to patient is secured. On the monitor, select 12 lead. Go to patient info. Select age. Using the keys at the top of the monitor, toggle and select, for this example, 84 years old. After confirming the age, press return. 84 years old. Now select gender. For this example, we will be using female. Confirm. Return. Go to patient info. Confirm the age and the gender. Return. Select acquire. When printing an ECG record, you select Summary. Go to Print Chart. Then go to Print Range. Once again, using the arrow keys at the top of the monitor, you will toggle and select which patient record you would like to print based off of the date and time. Once you have the proper record based off of date and time, select Print Record. This is similar to the code summary function on the PhysioControl LifePak monitor. Once a quality ECG prints, it is time to photograph the ECG record and send to the doctor and APC. Follow these steps precisely. 1. Tear the 2 or 3 interpretation patient data pages off of the printout and position them above lead tracing pages on a clean, flat surface. 2. Write the patient's name on the patient name line, as well as their date of birth next to their age on the patient data page. Also write the patient's name on the appropriate line at the top of the lead tracing pages. 3. Launch Camera app on the Surface Pro. Hold the Surface Pro flat and level, parallel above the ECG. Capture the photo at approximately 18 to 24 inches above. 4. Photograph the ECG record, then tap Photo Preview icon in the bottom right corner of the screen. 5. Tap See All Photos button and tap the photo of the ECG record. Crop the photo as needed. 6. Tap the Save a Copy button. 7. Tap the Print icon and change printer to Microsoft Print to PDF in the drop-down. Then tap the Print button. 8. Name the ECG record as appropriate, perhaps 12 lead-patient's name-today's date. Then tap the Save button to save the PDF in the Documents file. Before we send the ECG, we must confirm the data. Double-click or double-tap on the PDF to launch it into the full screen. Scroll left to right and up and down to view the page data and all lead tracings. A few questions to consider. Is the patient's name correct and legible on both pages? Is the patient's date of birth correct and next to their age on the patient data page? Is the patient's age correct? Is the patient's sex correct? Is the image clear and legible and not blurry? Are all leads visible? If these questions cannot be answered with a yes, then please reacquire the ECG and/or retake the photograph as needed. Do not send illegible or blurry or incomplete data to the doctor. If you cannot read it, then they cannot read it. Once you have confirmed the data in the PDF, it is time to send, interpret, and file the ECG record with the following steps. 1. Launch your email on the Surface Pro and select your @amerimed.net mail account and tap the New Mail button. 2. Tap the Insert button and then tap the Files button. Tap to highlight your patient's ECG record from the Documents window and then tap the Open button. 3. Add doctor and the APC emails in the To field. If the addresses are not pre-programmed, you will find a current list in your unit's binder. 4. Add a subject line and message body as appropriate and tap the Send icon. 5. Interpret your patient's ECG in the usual manner. 6. Call the doctor and/or the APC to discuss the results and a treatment plan. 7. Finally, don't forget to file a paper copy of the ECG under the red Test Results tab in the patient's purple Wellbe folder. And lastly, attach the PDF copy of the patient's ECG record to your EPCR. Follow the following steps. 1. Open Talma Soft and return to call. 2. Select the Narrative tab. 3. Select the Attachments header. 4. Tap the Add File button. 5. Select EKG from the drop-down menu. 6. Tap the Documents folder and tap to highlight the PDF of the patient's ECG record and tap Open. 7. Verify that the PDF is shown in the Attachment Files window. Thank you for your time and attention, and thank you in advance for ensuring that when we perform a 12-lead ECG on Wellbe Senior Care patients, and that these procedures are executed precisely, and that a delay of care is not created. During a patient visit, do not deviate from these procedures. However, if you discover ways of executing on these tasks smarter, better, or faster, please tell your training officer immediately. Thanks, and as always, be safe.